Dr. Gottlieb, news of the day today on the company that you sit on the board of, Pfizer. It is going to be granted priority review from the FDA for a full approval by early next year. How important do you think that is, given the vaccine effort in this country is flagging? Do you think it would really help?
Yeah, well, look, the announcement today about the priority review was sort of just a formality from the FDA. I don't think it really informs us about the process. The reality is the application was submitted. They started submitting it on May 21st, I believe. It's now fully submitted. I would expect the FDA to approve the applications of both companies, Moderna and Pfizer, within about 3 or 4 months of the first submission of that application. So I think that they're coming up on an approval. That's just my hunch about how the FDA process would work. The FDA made a statement today that they're going to approve these vaccines far in advance of the review deadline, the priority review deadline. That deadline would be around January. So I think that was an indication that they plan to do it sometime in the early fall, maybe late summer, early fall. And I think that time frame probably still holds.
Dr. Gottlieb, I asked this partly because of the new mask mandate in Los Angeles, but more thinking ahead to the fall when maybe cases will get worse nationwide and what the reaction should be. Should we care anymore, based on what you just said earlier about hospitalizations versus cases? Should we care about cases or only hospitalizations and death? And I guess a second part to that, if the hospitalizations that are happening are only unvaccinated, should that be on the people that are unvaccinated? Is there a risk to take and we should just not have to impose these rules again?
Well, look, I think we absolutely need to care. People are going to be hurt. There's going to be death and disease as a result of this wave of infection. I think the question is whether or not we should impose very costly, very burdensome mandates on society as a whole to try to temper the progression of this epidemic, if you will, the epidemic of Delta. And I think the answer to that is probably not. I don't think you're going to see broad sweeping mandates, mask mandates, closures of businesses at this point. I don't think there's popular support for that. People who were worried about COVID before and really supported the mandates largely are vaccinated now. And people who remain unvaccinated are people who largely haven't been worried about COVID. Now, I realize there's exceptions. There's a lot of people who want to get vaccinated still and can't. There's a lot of people who remain unvaccinated but are worried about the disease. But on the whole, the big contingent of people who really supported the mandates before have largely been vaccinated. So, this is a country where the rules are made by the consent of the governed. And I don't think that people are going to give their consent to mandates and intrusive restrictions at this point, because you're right. Most people who are worried about this disease have become vaccinated and now are far less worried, and rightfully so. I think you're far less likely to have a bad outcome from COVID, even if you develop a mild infection, being vaccinated.
On Thursday, Dr. Gottlieb, the World Health Organization warned that as long as the COVID continues to spread, it could continue to mutate and potentially into more lethal strains that could evade the vaccine. The WHO has been wrong on several things throughout the course of the pandemic. So I wanted to ask you what you thought the likelihood is that we could see, as this virus continues to spread, a mutation that is resistant to the vaccine.
It's possible. There's one mutation in particular that we've found that does seem to be resistant to the vaccine. It's not circulating at any appreciable levels, so it doesn't seem to be more fit. It's actually a variation of the Delta strain. The other strains seem to be covered well by the vaccine. But look, this virus is going to become endemic. It's going to be with us probably for eternity. It's going to evolve slowly over time, I believe, and I think we'll have to adapt the vaccines. And this is something that we may need to get revaccinated for from time to time. Could be annually. It could be biannually. We're not sure. We don't know how durable the immunity is, and we don't know how rapidly this is going to mutate. It seems to be mutating right now at the same rate of influenza B. A lot of virologists don't think it's going to continue to mutate at that speed, so it's going to slow down. It's sort of mutated very rapidly and reached a new fitness level, and it's going to stop evolving as quickly as it has. But it's going to continue to drift. It's going to continue to evade our immunity over time, and we're going to have to keep up with it. But we have the technology to do it. I don't think that this is going to evade us.
Shepard Smith here. Thanks for watching CNBC on YouTube.